the importance of this topic is the systemic associations. You know, your uveal tract is inflamed when you have systemic problems in the body. When you have problems in the body, you may have inflammation of this uveal tract. That is why this chapter is important. Any questions, anything which you wish to ask? किसी को कोई डाउट है तो पूछ लीजिए before we start. Any topic which you think is not covered or anything which is left you haven't understood. सब आ गया समझ में? चलो बढ़िया. So we will on this, guys. I told you that we have. हाँ, Dr. Priyam, neuro ऑफ्था difficult तो है. I agree, difficult तो है, but I am sure that if you read the notes well and afterwards if you solve the questions, you will be able to solve everything. सारे questions आ जाएंगे ना. एक जैसे तो है ही नहीं. Papilledema is far different from papillitis. No. Solve the questions. देखो अगर question solve नहीं करोगे तो नहीं बनेगी बात. क्वेश्चन सॉल्व करने पड़ेंगे साथ में. चैप्टर पढ़ो बट क्वेश्चंस भी देखो फिर, है ना, तभी कॉन्फिडेंस आएगा. चलो गाइस, सो एंटीरियर यूवियाइटिस का क्या मतलब हुआ? एंटीरियर मतलब आगे. सो आगे क्या है? आइरिस है. या तो बोलेंगे आयराइटिस या बोलेंगे आइरिडोसाइक्लाइटिस. द मीनिंग ऑफ द वर्ड साइक्लाइटिस इज दैट विद योर आइरिस your pars plicaटा is also inflamed because pars plicaटा is very close to the iris. ठीक है, तो अगर आइरिस के साथ पास प्लाइकेटा भी इन्फ्लेम है तो इसको बोलेंगे आइरिडोसाइक्लाइटिस. नो, व्हाट इज इंटरमीडिएट? इंटरमीडिएट मतलब बीच का. व्हाट इज देयर इन द बीच वाला पार्ट? इट इज योर पार्स प्लाना. सो इन्फ्लेमेशन ऑफ पार्स प्लाना व्हिच इज आल्सो कॉल्ड एज पार्स प्लानाइटिस. इट इज सेम एज पार्स प्लानाइटिस. नाउ व्हाट डू वी हैव इन द पोस्टीरियर पार्ट, गाइस? In the posterior part we have choroid, so it is same as the inflammation of choroid. Choroiditis. What about panuveitis? When your iris, your ciliary body, your choroid, all three of them are inflamed. Okay, this will be called as panuveitis. Okay, so this is the basic anatomical classification. Anatomical means जहाँ जहाँ inflammation है उसका वही वही नाम रख दिया. एंड इनमें से सबसे मेजर, सबसे इंपॉर्टेंट है योर एंटीरियर आइरिडोसाइक्लाइटिस एज फार एज अंडरस्टैंडिंग एंड क्वेश्चंस आर कंसर्न्ड. ओके, so both of them. So for understanding, for questions, your anterior is the most important. Anterior is the most important. So let us now discuss what is anterior uveitis in detail. Anterior uveitis in detail. ठीक है, that is what our next topic is. So friends, first of all they ask you what are the causes of this inflammation, why this uvea gets inflamed. So first and the most important cause is idiopathic. I don't know why there is an inflammation. It is idiopathic inflammation. I don't know what is the cause. And it is a question. Okay, idiopathic is the most common cause. Next, very very important is the HLA-B27 related. HLA-B27 related arthropathies. The joint problems which are related to HLA-B27 positivity. So who's gonna tell me what are these disorders? Who will tell me what are these disorders? Dr. Shriya? Wrong. Bilkul wrong. Rheumatoid arthritis is not HLA-B27. No. Ankylosing spondylitis is one. Ankylosing spondylitis is one. Anything else? Writer's disease is next. Writer's. Next, psoriatic arthropathy, psoriatic. And the next one is inflammatory bowel disease. ठीक है, inflammatory bowel disease like ulcerative colitis. Very good, Dr. Mubarak, good. Inflammatory bowel disease. ठीक है, so these are the four. Please remember, rheumatoid arthritis is not at all HLA-B27 related arthropathy. Okay, so it's very important. I hope now you understood what are the correlations. How does a patient of ankylosing spondylitis presents to you? Severe backache, stiffness. So if you have backache, stiffness, think about AS and uveitis. Okay, now apart from that, Sarcoidosis is not HLA-B27, but sarcoidosis is not HLA-B27. The next one is JRA. What is JRA? Juvenile rheumatoid arthritis. So arthritis, please ध्यान से समझिए. Rheumatoid arthritis is not associated with uveitis. It's not. But JRA is associated. Now, in juvenile rheumatoid arthritis, especially the POSI variety, especially the POSI type. POSI means less joint involved. This is the most common association, and this is common in children. So this is the most common cause of uveitis in children. I hope this is clear now. What is the most common cause in adult? Idiopathic. What is the most common cause in children? JRA. Which JRA? POSI type. Ye clear hai? Then comes the infections. What infections? You can have granulomatous infections like Dr. Anchal said, sarcoidosis, TB, sarcoidosis, syphilis. What are the granulomatous infections? TB, sarcoidosis, syphilis, leprosy, vaginous, etc. Is that okay to all of you now? अब कोई confusion तो नहीं है? ठीक है? यहाँ तक समझ में आ रहा है? The next one is important, Behcet's syndrome or Behcet's disease. Important, Behcet's disease. Okay. Next is other infections like HIV. HIV भी हो सकता है. I'm not saying you can have any infection like HIV. You can have skin disorders as well. You can have what? Some allergies, by which connective tissue disorders. So there are so many things by which you can get uveitis. Systemic associations are many. Systemic associations are many. Connective tissue disorders. ठीक है? So many causes of uveitis, but still, what is the most common? Idiopathic. We don't know what is the cause. Now friends, this is again a cause of PVR. What is PVR? Painful decrease in vision with a red eye. Pain, decrease in vision and a red eye. So what are the other causes of PVR? Other causes of PVR? आप बोलोगे मैडम तो बस पढ़ा नहीं रही, मैडम पूछे जा रही है ना? आज तो मैडम पढ़ा नहीं रही, अब तो हो गया ना सारा ऑफ था. बताओ. Anyone? What are the causes of PVR? PACG. Very good. What else? Very good, Dr. Ishwarya. Now this time I'm happier that you have mentioned specifically a primary angle closure glaucoma. Very good. Keratitis is another, corneal ulcer. Very good. This is the third one, and fourth one is endophthalmitis. So there are four causes of PVR. We started with endophthalmitis, corneal ulcer, angle closure glaucoma and uveitis. These are four causes. What is flares? What is flares? I don't know. What is flares? अभी यहाँ मटन फैट की पीप की अभी बाद में बात करेंगे. Wait. I'm asking you what are the other differential diagnoses of PVR. So please remember these four. First, this is important. Now, tell me guys, when you see the signs in anterior uveitis, which instrument would you like to use? You have problems mainly here in the anterior segment. Which instrument would you like to use? So signs will be seen on slit lamp. Okay, obviously for anterior segment you will use a slit lamp. Clear? So the first sign is cells, the inflammatory cells. These are mainly your polymorphonuclear cells, and these cells in the anterior chamber will be seen as small white dots, cells. Okay? These are polymorphonuclear cells. Now what is the important question? The cells is a marker. It is a marker of activity of uveitis. मतलब क्या हुआ? That means if I see cells, it is a acute attack. If I don't see the cells, it is a chronic attack. It is a chronic thing. It is a marker of activity. Question number 1. Okay, this is a marker of activity. Now, what about the second thing? The second thing which we see, as somebody has, Dr. Sunil has told us, it is flare. Flare. And what do you mean by flare? It is the leakage, because when you have inflammation, the lipids will leakage. Leakage of lipids from the inflamed capillaries. भाई जब इन्फ्लेमेशन होती है तो लिपिड लीक कर जाते हैं ना, सो यहाँ पे भी लिपिड लीक कर रहे हैं कैपिलरी में से. Now what is the question here? The question is that this is the marker of severity. That means if you have lot of flare, your attack will be severe. If you have less flare, your attack will be less severe. Now this is the first to come. Flare is the first sign to come. Flare is the first sign to come. What do you mean by that flare type? What do you mean by flare type? Please elaborate your question. I am not able to understand. Dr. Sahu, what do you want to say? Kindly elaborate your question, bache. No, cells are different and flare is different. Though they look very similar, but flare is what? Flare gives turbidity to your aqueous. Normally your aqueous humor is optically clear, but when you have flare, it gives as a look of white thing. It is your turbidity to the aqueous humor. That is your flare. Okay? सेल्स वाइट सेल्स दिखेंगे, वो मूव होते हैं. फ्लेयर क्या है? फ्लेयर एक डिफ्यूज, एक दिखाएगा कि क्लियरिटी नहीं है, योर एक्वस इज नॉट क्लियर. ठीक है, एक डिफ्यूज ह्यू आ जाती है. दैट इज योर फ्लेयर. नाउ माय नेक्स्ट इंपॉर्टेंट क्वेश्चन, देखिए प्लीज एवरीवन सी. द सेल्स आर रोटेटिंग लाइक अ ब्राउनियन मूवमेंट. Cells are rotating like that, but there are certain cells which are heavy, so they cannot move, and because of the gravity they settle down where? At the lower part and at the back of the cornea. Can you see? So these cells which are heavy, which are settled on the back of the cornea, will be called as keratic precipitates. समझ आ रहा है? So this is the third thing, keratic precipitates. They settle down inferiorly at the back of the cornea, on the endothelium of the cornea. Because they are heavy, they cannot rotate, they can't move, so they settle down. Now, keratic precipitates are the indicators of etiology. Matlab, they indicate the etiology. Etiology means what is the cause. How can you come to know the cause? Looking at the KPs, if the KPs are very heavy, greasy, like mutton chicken, that means these are mutton fat KPs, and that means your etiology is granulomatous. What is the etiology? Granulomatous. Sometimes your KPs are very thin, they are fine, very thin, they are very fine. That means the etiology is non-granulomatous. It's very easy to understand. मैं समझाती हूँ. You are looking at a patient and you saw that there are big KPs which are very thick, greasy. Then you think about TB, sarcoid, you think about leprosy. Okay? But if you see thin KPs, you think about something else, but at least not TB, sarcoid. Am I clear? What do you understand by etiology? So KPs can be of two types. Looking at the KPs, you can tell whether the etiology is granulomatous or non-granulomatous. ठीक है बच्चे, ये सबको समझ में आता है? And this is also a picture question. This is also a picture question. Now the next thing what we see in iris is nodules on the iris. So we have two types of nodules. The first is Copies nodules. Copies. कहाँ है ये Copies nodules? At the pupil. Can you see? These nodules are at the pupil. What about the second nodule? Second nodule is Busaka's nodules. Busaka. And Busaka nodules are at the base of the iris. Base. बहुत ही simple है learn करना. बहुत ही simple है learn करना. B and B. Okay, B and B. Busakas are at the base. Very good, Dr. Anu. So Busakas are at the base of the iris. Simple to remember, B and B. So four things again I'm revising. First is the cell, indicates the activity. Flare, lipids, which indicates the severity. Third is your what? Third is your KPs, which indicate the etiology. And the fourth is your nodule, which indicates whether you have which type of nodules. Okay, that indicates what type of nodules you have. Now what is the next thing? So guys, the next thing what we see is the most important finding here, something about the pupil. So this is the only condition in ophthalmology where you have a painful red eye with a small irregular pupil. Very very important condition. Small irregular pupil. Pupil कैसा होएगा? छोटा सा irregular. Now why this irregular pupil? Because you have adhesions. Because of adhesions. What do you mean by adhesions? Sin AK. Glaucoma में पढ़े थे ना sin AK. We develop adhesions when you have inflammation. Now this is an important question. What type of sin AK these are? These sin AK are mainly posterior sin AK. These are mainly posterior sin AK, mainly. And what are posterior sin AK? First understand guys, and then you can write down. Please see. So whenever you have inflammation, you can develop adhesions. Here in uvea, the sin AK are mainly posterior. Posterior sin AK means that you have adhesions between your iris and lens. So iris and lens will chipkofy here. They get stuck to each other. Are you able to understand? These are your posterior sin AK. Now think about it guys. After certain days, after few days, what will happen to the iris? The iris will have a change in its shape. The iris will look like this. Yes or no? So this iris will be called as the Bombay iris. Iris Bombay. The change in the configuration of iris because of the sin AK. This will be the Bombay iris. Am I clear? Now tell me what can be the complication when you have a iris Bombay. पूरा बताओ. कौन सा ग्लाकोमा डॉक्टर मोहम्मद? प्राइमरी ओपन एंगल ग्लाकोमा, सेकेंडरी ओपन एंगल ग्लाकोमा या क्या? PCOG, प्राइमरी एंगल क्लोजर. Which angle closure? Yes, it is the secondary angle closure glaucoma. Why secondary? Because it is due to sin AK. It is not a hypermetropic female. Am I clear? A primary angle closure will be in a anatomically predisposed person who has a small eye. But this sin AK, this glaucoma is because of the adhesions. Am I clear? Yes? Okay? Clear everyone? So you can write down now everything. Please understand. The pupil is small and irregular. Irregularity is because of adhesions. Which adhesions? Sin AK. Which type of sin AK? This is a very commonly asked question. Which sin AK? These will be your mainly the posterior sin AK. Mainly the posterior ones. Okay? What do you call this? Iris Bombay. And what complication? You can have a secondary angle closure glaucoma. ठीक है बेटा? ये बहुत important topic है और बहुत easy है. It's nothing is difficult here. You just need to remember few important points, and when you do questions, you will definitely be able to understand. ठीक है? Now remember, you had a small irregular pupil. What if you dilate this pupil? What if you dilate this pupil? Yes, they can cause cataract as well. Cataract is also seen na second, your complicated cataract. So if you dilate this pupil, it will become a festooned pupil when you dilate it. Okay? And this was a picture question in your exam in 2019. Okay, a festooned pupil, a dilated irregular pupil which will be seen in uveitis. A dilated pupil which will be seen in uveitis. Okay? Now what else? The next finding will be a hypopion. So you can also, because of the inflammation, you can also have a hypopion. You can also see a hypopion. Okay? Chalo. So this was about anterior uveitis. Now let's talk about the management. So there's an inflammation. How will you treat? The first thing is you should give topical steroids. These are the drug of choice. Topical steroids are the drug of choice. Because you have inflammation, so you must give topical steroids. What else? Because there is a lot of pain, so you should also give cycloplegic mydriatics, isn't it? Because there is an inflammation, you should give cycloplegic mydriatics. Now again 2019 you had a question from this topic. Cycloplegics, what is the role of cycloplegic? Hanji, what is the role? The first role is that it decreases the pain. How does it decrease the pain? It relaxes the ciliary muscle. Very, very good. Very good. It relaxes the ciliary muscle. So this is the major job. This is the major job. What else is the role, guys? You know the pupil was small, irregular. Because of that, there can be a complication. So what you don't want to have? You don't want to have synecdoche. So what if you dilate the pupil? The synecdoche will be broken. अगर आप प्यूपिल डायलेट करोगे तो जो एडहेशंस बन गए वो ब्रेक होंगे ना, सो इट विल ब्रेक द साइनेके, सो इट विल प्रिवेंट ग्लाकोमा, it will break the synechiae. When it dilates, the pupil will dilate, it will break the adhesions, okay, and it will prevent further synechiae formation. ये और प्रिवेंट करेगा कि synechiae दोबारा ना बने. Okay, so they have asked you what is not the role. So these are the rules. Now, suppose, yes, Dr. Priyam, decrease IOP is not the rule. Decrease IOP is not the rule. Okay? Suppose, if you have a high IOP, suppose आपके adhesions बन गए, patient का IOP भी high है, अब उस IOP को कैसे कम करोगे? Which drug would you give? If increase IOP, what not to give? मैनिटॉल, बेटा मैनिटॉल तब देते हैं जब प्रेशर बहुत ज्यादा बढ़ा हुआ है. ही इज इन अ एंगल क्लोजर ग्लाकोमा अटैक. Mannitol is a systemically acting drug. Suppose if the patient, see, imagine if the patient has a pressure of 30 millimeters of mercury, it is high, but it is not that high that I start him on mannitol. Understood? Mannitol में रोज 4-5 दिन के लिए थोड़े ना दूंगी उसको. See, this is what I want to tell you. There are two drugs which I never want to give. I would never give a pilocarpine. These are contraindicated. And I will also not give PG analogs. Why? You tell me the answer. Why? What not to give? These drugs are contraindicated. Why? Yes. Inflammation is the side effect of PG analogs, and there's already an inflammation. I would never like to give. Pilocarpine also causes inflammation, but more than that, pupil is small. I don't want to decrease the size of the pupil further. Okay? Both of them are inflammatory. डॉक्टर प्रियम क्या बता रहा है बच्चे? मैं कह रही हूँ कि अगर इंट्राऑक्यूलर प्रेशर बढ़ गया है तो मैं क्या नहीं देना चाहूंगी, है ना? कौन से आईओपी कंट्रोल करने को ड्रग्स नहीं देना चाहूंगी. सो आई वुड रादर गिव ओनली अ टिमोलॉल. a beta blocker. ठीक है, timolol will be given, but not pilocarpine and PG analogs. I'm talking about which anti-glaucoma drugs should be given, which are absolutely contraindicated. So pilocarpine and PG analogs are contraindicated. I hope this much is okay. चलिए अब जरा फिगर्स देख लेते हैं. So this is a typical picture question. Typical picture. What do you see, guys? A irregular pupil. I hope everybody can see. This is a irregular pupil. Yes or no? A small irregular pupil, है ना? Now, what do you see? Here again you have a hypopyon, a picture question. Typically, this is the slit of the cornea, and the small you see are mud and fat KPs. Very, very important picture question. See how the Kopis nodule look like. This is your Kopis, and these are on the base. These are your Busaka's nodules. Okay, not a picture question. Now I will be showing you, this is an important question. 2019 you had a picture of a festoon pupil. Can you see the irregular dilated pupil? पहले ये छोटा था, फिर आपने डायलेट किया तो ऐसा हो गया. Okay, now see another picture of keratic precipitate. So this is your slit of the cornea, this is your iris, the colored iris. Now what do you see? Again the small, these are your keratic precipitate. ठीक है, which one do you want? Dr. Imad, which one do you want? ये mutton fat KPs. There are two pictures of mutton fat KPs I have. Now, very important question. Please see. When the KPs are settling down, they settle inferiorly. So they create a triangular configuration. Can all of you appreciate? These are settled down in the form of a triangle. The upper part is clear. This is clear. So this triangle, please write down, this triangle is called as the arch triangle. Okay, please write down this triangle in which KPs are arranged. This triangle is called as the arch triangle. Keratic precipitates are arranged in the form of a triangle called as arch triangle. The configuration is like a triangle. Okay, this configuration is arch triangle. So this was about anterior uveitis. You must remember everything. Chalo. So the next topic. The next topic is the second one, which is intermediate uveitis. Intermediate. Intermediate. So intermediate से क्या समझते हैं? Intermediate uveitis simply means pars planitis, inflammation of pars plana. So again, guys, most common cause of this inflammation is idiopathic. We don't know what is the cause, why there is an inflammation, but still there is an inflammation. The next very important is sarcoidosis. So whenever you have a question on sarcoidosis, please think about intermediate uveitis also. It's very common in sarcoidosis. Okay, please remember the question. Now, guys, symptoms. You have to tell me the symptoms. I'll give you a clue. So this time the inflammation is in this part. When your pars plana is inflamed, the nearby vitreous is also inflamed. So do you think the patient will have red eye? He will have a pain? What will be the presentation? Will he have a pain and a red eye? Tell me. So what will you see? The only complaint of the patient will be mainly the floaters. They can also have a decrease in vision, but most common is floaters. I hope this is clear with the diagram. है ना? You remember the floaters? Inflammation of vitreous, increased number of WBCs, more floaters. ठीक है बच्चे? Dr. Rishabh, okay? This is what you want? What last point? Decreased vision? Decreased vision can also be there. Blurring of vision can also be there. Blurring of vision. ठीक है, blurring of vision can also be there. But please understand, there's no pain, there's no red eye. ठीक है. Now, would you think the signs would be seen again on slit lamp? If you see a patient on slit lamp, you will say ये patient मेरा दिमाग चाट रहा है, खराब कर रहा है मेरा दिमाग, इससे तो कुछ भी नहीं है, क्योंकि slit lamp तो ठीक होगा. Slit lamp let you see till lens only, and the problem is behind the lens. So which instrument would you use now? Tell me, which instrument would you use now? स्लिट लैम्प पे देखने पे लगेगा सब कुछ तो ठीक है, पेशेंट क्यों पागल बना रहा है? डॉक्टर प्रियम, डॉक्टर प्रियम, तुम्हें नई कॉन्सेप्ट समझ में आया ऑफ्थैल्मोस्कोप का अभी भी, है ना? सी, डायरेक्ट ऑफ्थैल्मोस्कोप विल लेट यू सी ओनली दिस पार्ट ऑफ रेटिना, मेनली द सेंट्रल पार्ट ऑफ द रेटिना. दिस इज द पेरिफेरी पार्ट ऑफ द रेटिना. पेरिफेरल है ये, तो पेरिफेरल कैसे दिखेगा? इनडायरेक्ट ऑफ्थैल्मोस्कोप. ठीक है, by indirect ophthalmoscope. ठीक है. All right. Now what will you see? So there are three classical signs. The first, as Dr. Sunil has correctly told us, snowball. First is the snowball. Second is the snowbank, snowbanking. First is snowball, second is snowbanking, and third one is candle wax dripping sign. Candle wax dripping sign. So if I say which of them is more important, snow banking is rather the pathognomic sign. Snow banking is the pathognomic sign. Pathognomic sign. ठीक है. जब आप indirect से देखते हो तो vitreous में छोटे छोटे white दिखते हैं, छोटे छोटे white. It appears as if snow balls are there, है ना? डॉक्टर प्रियम सुनो मेरी बात बेटा, सॉरी की कोई बात है ही नहीं, हम सब से यहाँ सीख रहे हैं ना. We are learning here, so nobody needs to be sorry or even thank you to anybody of us, है ना? We are all learning. We are happier that we make mistakes here, but not in the exam. The more important thing is that you are practicing here. Whosoever student is answering, that means he is attentive and he wants the exam to get clear. चुपचाप लिखने में इतना नहीं आता. आप जब बोलते हो, जब आप जवाब देते हो, you make mistakes. This is the time when you learn, isn't it? This goes for every subject. If you don't scroll up your mind, you will be having difficulty in clearing, है ना? आप क्लास में जवाब देते हो तो इसका मतलब कुछ तो सोच रहे हो. आप गलत जवाब दे रहे हो तो आप लर्न कर रहे हो, आप सीख रहे हो. सीखने के लिए तो बैठे हैं हम. यहाँ कर लो मिस्टेक्स जितनी करनी है, एग्जाम में नहीं करनी लेकिन हमें. ठीक है. So all of you, sorry for sorry मैम, अरे बाप रे. तो सबको समझ में आया? अच्छा, ये डॉक्टर मोहम्मद सी, अगेन दिस इज वेरी इनकम्प्लीट थिंग, इनकम्प्लीट ऑफ्थैल्मोस्कोप. पूरा बताओ. अब आपकी ऑफ्था खत्म हो गई, अब आप अच्छे से बताओ मैम ये इनडायरेक्ट से दिखेगा, ये डायरेक्ट से दिखेगा. ठीक है. स्नो बैंकिंग अभी बता रही हूँ, रुक जा, एक मिनट रुक जा. सो स्नोबॉल क्या बताया मैंने? स्नोबॉल इज लाइक you will see white thing, white छोटे white cells in the vitreous. You call them snowballs. Now snow banking means that your entire pars plana. आपने बैंक देखा, रिवर का बैंक. व्हाट इज रिवर बैंक? नदी का किनारा. नदी के किनारे पे जब वो आती है, वेव आती है, तो नदी का किनारा नहीं हो जाता white. So your bank of the river or your beach, you can say that boundary becomes white when your river comes, when your wave comes and go back. So this looks like as if there's a bank of snow. ठीक है. So that is called as river snow banking. White. Whole pars plana is white. Whitening of pars plana. ठीक है. कैंडल वैक्स ड्रिपिंग इतना इंपॉर्टेंट नहीं है. जैसे कि कैंडल से वैक्स निकलता है, you will see the sheathing of the vessels in this manner. Sheathing of vessels in this manner. So just skip it. Just skip this sign. So which is more important? Please remember, snow banking is a more important sign. It is very pathognomic. Now how do you treat again? Guys, you have to give steroids, but not in topical form. You may give oral steroids or you give intravitreal. Isn't it? You give oral or intravitreal steroids. Now this is very important. What is posterior uveitis? Very important question. So posterior uveitis, friends, first of all, remember the most common cause is not idiopathic. Most common cause is toxoplasmosis. Okay, this is question number 1. Most common cause is toxoplasmosis. Toxoplasmosis. Okay. Now, guys, toxoplasmosis can cause infection, inflammation in uvea in two forms. Either the active inflammation or the chronic inflammation. Okay. Now, chronic से क्या समझते हैं? There will be scarring. Yes or no? Chronic means that the lesion is there for a long period of time and now there is a scarring. Scarring means thinning. Scar बन गया है, वहां से thin हो गया है ना? So what do you see? Classically in chronic you will have a scar at the macula. You call it macular scar. Very important question. Macular scar. Yes, long time the scarring हुई, वहां पे macula पे scar बन गया. Okay, chronic. Now, very commonly asked question, guys. Headlight in fog appearance. Where do you see this? Headlight in fog appearance. So, what is this headlight in fog appearance? First of all, I'll explain you and then I'll give you time to write. First of all, just see this picture and try to understand what I am talking about. See? All of you see? So guys, have you ever driven a car in a foggy day or foggy night? करा होगा आप लोगों ने. सबसे पहले प्रियम का जवाब आया, हाँ मैडम मैं तो बहुत करता हूँ. कहाँ रहते हो तुम? हमारे तो होता ही नहीं यहाँ पे, है ना? सर्दियों में होता है बहुत foggy, but we definitely we get scared in going out in this foggy time. Long term drive पे जाता है, हाँ प्रियम जाता ही होएगा. चलो देखो, तो आप कभी गए हो फॉगी नाइट पे, तो आपका कोई दोस्त भी सामने से आ रहा है सपोज, तो व्हाट विल यू सी? व्हाट विल यू सी? You will see that the light is shining, the headlight is shining and there is a fog all around. Isn't it? This is your headlight in fog. अब देखो यहाँ क्या हो रहा है? Active choroiditis में क्या होगा? There is a lesion. There is a granuloma near the macula. Toxoplasma is very specific that it involves macula. It involves macula. So obviously it will cause less central vision. Macula is responsible for central vision. So you have an active lesion here and you have lot of inflammation that you have, that your vitreous is inflamed. So it gives like appearance of fog and this is your headlight. ठीक है, तो यही चीज मैंने यहाँ लिखी है, देखिए. When you have active inflammation, you will have cells, you will have reaction in the vitreous, and you also have granuloma. So this granuloma shines as if it is a headlight in fog. Okay, please remember this headlight in fog appearance. Many times a question has been asked on this. Many times. Many times. Okay. I'll also show you a picture of macular scar in a short while. Both of them are important. ठीक है, चले आगे. अभी देखिए इसको, मैक्युलर स्कार को देखिए. So this is a typical macular scar, a scar at the macula, which is 90% of times because of toxoplasm. Obviously, the patient will have a very poor vision. ठीक है, retina has become very thin, the photoreceptors are damaged. This is scar at the macula. Patient hardly has any vision. Okay, patient hardly has any vision. चलो इसका आंसर बताओ. What is the answer here, friends? B. Snowbank is pathognomic. Snowbank is pathognomic. ठीक है. हाँ जी, ये बताइए, व्हाट इज द आंसर फॉर दिस? टिपिकल प्रेजेंटेशन, वेरी टिपिकल। सबकी पिटाई होगी। ये एक्चुअली B27 ग्रैनुलोमैटस है। एक्चुअली B27 क्या है? इट्स अ नॉन ग्रैनुलोमैटस थिंग। व्हाट इज ग्रैनुलोमैटस? टीबी, सार्कोइड, सिफिलिस, है ना? सो इसमें से क्या फिट बैठता है? पेशेंट हु हैज ब्रेथलेसनेस, जॉइंट पेन, this is ocular sarcoidosis. Probably you have not covered this. Sarcoidosis is a very important differential diagnosis of TB. है ना? It's a very important differential diagnosis of TB. So many times you get confused. TB can have this manifestation, so is sarcoid. ठीक है? जब आपका मेडिसिन हो जाएगा आपको बड़े अच्छे से समझ में आएगा, बट एक्चुअली तो बिल्कुल भी नहीं होना चाहिए। ओके, चलो ये बताएं, अगेन अ सिमिलर क्वेश्चन, व्हाट शुड बी द आंसर हियर? फिर से वही, फिर से वही। क्रॉन्स डिजीज क्या है बच्चे? क्रॉन्स क्या है? क्रॉन्स डिजीज क्या है? क्रॉन्स डिजीज, और इसका मतलब तो ये हो गया तुम्हें ग्रैनुलोमैटस डिसऑर्डर नहीं पता। इसका मतलब ये हुआ तुम्हें ग्रैनुलोमैटस डिसऑर्डर नहीं पता। सो इट्स अ IBD which is included in HLA B27, है ना? सो HLA क्या है? नॉन ग्रैनुलोमैटस। व्हाई आर यू सेइंग ग्रैनुलोमैटस? बताओ। अग्री? समझ में आया? अब देखो, छोटी सी बात देखो, बहुत छोटी सी चीज है, आपने पूरा पढ़ लिया, आपको पता भी है, you know what is HLA, you know all the disorders, you know what is granulomatous, but when you come to questions, both the questions are wrong, है ना? When it comes to solving questions, both the questions are wrong, but the next time if you do such a question, you will think about this manner, है कि नहीं? अभी तो आपने जो बता दिया, जो बता दिया ठीक है, बट जब आप अगली बार करोगे तो आप फिर इस बारे में जरूर सोचोगे कि मैडम ने कुछ ऐसा बताया था और हमने क्वेश्चन में गलत किया था, है कि नहीं? यस और नो? फिर जरूर सोचोगे अगली बार कि कुछ ऐसा था, मेरे को ये देखना, ये नहीं कि बस मैंने केपीज देखे और ग्रैनुलोमैटस कर दिया। ऐसे नहीं कि मैंने बस केपी देखा और मैंने ग्रैनुलोमैट। केपीज आर ऑफ टू टाइप्स गाइस, टू टाइप्स। ओके, so that is why I always say questions are important. You read the topic but you simultaneously solve the questions. If you don't solve the questions, it's tough, मुश्किल हो जाता है बाद में। ठीक है, साथ में थोड़े थोड़े करने हैं यार क्वेश्चंस, कौन से बहुत सारे करने हैं, थोड़े थोड़े क्वेश्चंस करो, देखो कितना कॉन्फिडेंस आएगा आपको, अच्छा लगेगा आपको। चलो ये देखो, ये थोड़ा मुश्किल है, थोड़ा सा मुश्किल है, इट्स लिटिल ट्रिकी, ट्राई ऑल ऑफ यू। वेरी गुड, गुड, इट इज FFA। FFA, which is not necessary. Not necessary means, suppose if you have a recurrent means probably there is a problem in the patient. हो सकता है कोई सिस्टमिक प्रॉब्लम हो, चेस्ट एक्सरे टीबी के लिए करा लोगे, HLA कराना पड़ेगा, ESR कोई भी क्रॉनिक इन्फेक्शन रूल आउट के लिए, चेस्ट एक्सरे टीबी के लिए, सार्कोइडोसिस के लिए। ठीक है भाई, एक पेशेंट है जिसे बार बार यूवीआइटिस हो रहा है, तो आप एक एग्जामिनेशन नहीं कराओगे कि भाई इसके बॉडी में कोई दिक्कत हो सकता है इसे टीबी हो सकता है इसे कोई स्किन डिसऑर्डर हो सकता है इसे सार्कोइडोसिस हो, कोई HLA ही हो। यस, बट FFA इज नॉट इम्पॉर्टेंट। FFA इज फॉर रेटिना, डायबिटिक रेटिनोपैथी एंड सो ऑन। ओके, जमती है कोई बात? चलो, the next topic is sympathetic ophthalmia. First, give me 2 minutes to explain and then you can write down. Look at me everyone. There was a soldier at the border and he got hit by the army in his eye, gunshot injury. Okay, that was a gunshot injury, and that gunshot injury damaged his ciliary body. Suppose his right eye had a gunshot injury on the ciliary body. Obviously, this eye is damaged. This is a traumatic eye. ठीक है, this is a Penetrating injury to ciliary body. Ciliary body is considered the danger area of the eye. Now, we don't know why and how, but some kind of immunological reaction in the other eye. Some kind of immunological reaction occur in the other eye where the uveal tract of the other eye, which was not injured, this also becomes inflamed. ये इंजरी हुई, इसकी वजह से कभी इसमें भी इन्फ्लामेशन हो सकता है. So what is it? By definition, it's a bilateral granulomatous non-suppurative uveitis because of trauma, a penetrating trauma to the ciliary body of one eye. समझ आया? Now this generally happens minimum after 14 to 15 days minimum. Now अब ये सोल्जर की ये आंख तो चली गई, इसकी सिर्फ ये आंख बची. He is just 20 years of age. So how will we come to know that he has developed a sympathetic ophthalmia? What is the first symptom? The first symptom is loss of accommodation or difficulty to read. He is only 20 years of age. He cannot have presbyopia. He cannot have presbyopia. वो आके आपको बता रहे डॉक्टर साहब मुझे पास का देखने में दिक्कत आ रही है. क्यों दिक्कत आ रही है? Because his ciliary body is inflamed, so ciliary muscles are not working properly. Clear, friends? Not loss of pupillary dilatation, loss of accommodation. Am I clear? Because his other eye ciliary body also starts inflaming, so he will have problems in near vision. This is the first symptom. What about the first sign? This is retrolental flare. Retro means behind, lens means, lente means lens. तो यहाँ पे inflammation दिखाई देगी. This is the first sign. You can also see Dallen-Fuchs nodule in the retina. ठीक है, आप लिखिए इसको. Quickly, please write down and don't write these two. Don't write these two. Skip writing that. ठीक है? What important thing is that you have a penetrating injury. Penetrating injury. Where should the injury occur? To the ciliary body. Ciliary body is the danger area of the eye. Ciliary body is the danger area of the eye. Ciliary body is the danger area of the eye. ठीक है? So there are so many questions on it. Once upon a time there was a question. Sympathetic ophthalmia occurs because of injury to what? Because of injury to ciliary body. In NEET 2020, they had a very simple question. Sympathetic ophthalmia occurs because of what injury? It occurs because of penetrating injury. बहुत ही simple thing. But they can ask you more. ठीक है बच्चे, ये क्लियर है सिंपैथेटिक ऑफ्थैल्मिया. Retrolental flare, floaters is a symptom. Retrolental flare is a sign. You will see flare and cells behind the lens. You understand the difference between floaters and flash? You understand the difference between symptoms and signs, है ना? Floater is a symptom. Flare is a sign which I see as a doctor. Floater is seen by the patient. ठीक है बेटा? These definitely can cause floaters. Sign is seen by the doctor. Yes. ठीक है ना? Symptom by the patient. Okay, डॉक्टर शुभम समझ गए बच्चे? फ्लेयर मैं देखूंगी लेकिन पेशेंट को फ्लोटर दिखाई देगा. ठीक है, चलो अब मुझे तुम बताओ, तुम में से कोई मुझे बताओ. हाँ, आप मुझे बताओ, हाउ विल यू ट्रीट इट? हाउ विल यू ट्रीट इट? हाउ विल यू ट्रीट सिंपैथेटिक ऑफ्थैल्मिया? सोल्जर आया, सुनो मेरी बात सुनो, ध्यान से सुनो. वो सोल्जर आपके पास अब आया है, वो सोल्जर आपके पास आया है, वो कह रहा है डॉक्टर मुझे इस आंख से पास का कम दिख रहा है. अब इन्यूक्लेशन करके क्या करोगे? इमाद, अनु, अब इन्यूक्लेशन करके क्या करोगे? सिंपैथेटिक ऑफ्थैल्मिया हो गया है, सो अब क्या करोगे? इन्फ्लामेशन को कम करोगे. यू विल प्रिवेंट द इन्फ्लामेशन बाय गिविंग स्टेरॉइड्स और इम्यूनोमॉड्यूलेटर्स. समझ आ रहा है? जो आप बता रहे हो enucleation is for prophylaxis. It is for prophylaxis. Understood the word prophylaxis? Suppose there is a damage to ciliary body of this eye. You want this eye should not get damaged. You take out the eye. Okay? Enucleation is not the treatment. Treatment is steroids. Is it clear to everyone? Is it clear to everyone? Enucleation is not the treatment. Enucleation should be done before problems occur. The treatment is steroids or immunomodulators. ठीक है? Okay? चलो, very good. देखिए अब. So, I told you that I'll discuss staphyloma with you. This is the last topic, staphyloma. So, what exactly is staphyloma? Look at me, guys, look at me. So, staphyloma is the protrusion of outer coat of the eye. So, what is the outer coat? Either the cornea or the sclera. But not only the outer coat. It has to be lined by the uveal tissue behind. So, cornea के पीछे uveal tissue क्या है बच्चे? Cornea के पीछे uveal tissue क्या है? The iris. What is the uveal tissue behind cornea? The iris. What is the uveal tissue behind this part? The ciliary body. The uveal tissue behind this is your choroid. So in short, you can write down what is staphyloma. Staphyloma is a ectasia. Staphyloma is a ectasia. Ectasia of what? Ectasia of outer coat of eyeball with underlying uveal tissue. With underlying uveal tissue. समझ आ रहा है मैं क्या बता रही हूँ? This is the definition of staphyloma, that your cornea or your sclera is protruded. Either your cornea or your sclera is bulging out with the underlying uveal tissue. So what is the uveal tissue behind cornea? The iris, the ciliary body, or the choroid. ठीक है? So if I say what is anterior staphyloma, guys? What is anterior? Anterior में क्या bulge करेगा? The cornea with the iris. Yes or no? In anterior, what will be bulged? The cornea plus iris together. And this was a picture question in your exam this year. I'll just show you what is it. देखिए. Please see. Don't say this is proptosis. ये proptosis नहीं है. प्लीज इसको प्रोप्टोसिस मत कहना. इसमें पूरी आंख बाहर नहीं आ रही. इसमें क्या हो रहा है? कॉर्निया बल्ज कर रहा है. नॉट ओनली कॉर्निया बट द आइरिस इज ऑल्सो लाइंग बिहाइंड. Okay, Dr. Kalgi, it's not only iris, it is cornea plus iris together. How is it different from proptosis? Proptosis occurs when your eyeball is pushed forwards because of the problem behind the eye. धक्का मर गया है आई को. यहाँ पे आई बॉल अपनी पोजीशन पे है बट बल्ज कर गया है. कॉर्निया और आइरिस बल्ज कर गया. ठीक है. नाउ हैव अ लुक एट दिस पिक्चर अगेन. प्लीज सी. नाउ देयर आर, ये टॉपिक आपको नहीं पढ़ना तो छोड़ सकते हो बट एटलीस्ट रिमेंबर एंटीरियर. ठीक है. देखिए. सो स्टेफाइलोमास इन टोटल आर ऑफ 5 टाइप्स. Anterior I have discussed. What was anterior? Cornea plus iris. What is intercalary? Intercalary is projection at the limbus. Your limbus is bulge. और limbus के पीछे क्या है? Iris, है ना? Third क्या है? Ciliary. What is the protrusion of outer coat? The sclera. Sclera के पीछे क्या है? Ciliary body. That is why the name ciliary body. Now equatorial कहाँ है? Again the sclera and choroid. Posterior also in sclera and choroid. ठीक है. Please write down one question here. Posterior staphyloma. You can just write down the next one. Posterior staphyloma. This is the bulge of sclera plus choroid at the disc. ठीक है. और macula. At the disc or the macula. Please remember posterior staphyloma. We have already seen that this is seen in pathological myopia. किसी बच्चे ने मुझसे क्वेश्चन भी पूछा था, व्हाट इज पोस्टीरियर स्टेफाइलोमा, सो आई टोल्ड यू, आई विल टेल यू लेटर ऑन. Because in pathological myopia, your axial length is high, eyeball is growing, so it becomes ectatic posteriorly. It gives rise to a posterior staphyloma. ठीक है, ये याद करना है, ये तो जरूर पढ़ना है. Anterior and posterior. Anterior and posterior are important. हाँ जी, कोई बताएगा ये क्या है? Anyone, what is this? Anyone, what is this? Very good, Dr. Ishwarya. It's not intercalary. What was intercalary, beta? Dr. Mohammed, intercalary is bulge at the limbus, but if you see carefully, the limbus is actually spared. The limbus is normal. There's a bulge behind the limbus at the region of ciliary body. So this is your ciliary staphyloma. Very good, Dr. Ishwarya. Dr. Sushila also, very good. This is a ciliary staphyloma. समझ आ रहा है? Intercalary कहाँ होगा? अगर यहाँ पे bulge होगा. Intercalary is this one. There are different causes. There are different causes. Anterior staphyloma का क्या cause है? When you have a perforated corneal ulcer. Different causes, na, depending upon the pathology. Different perforated corneal ulcer. Patho and posterior staphyloma, it is your myopia. ठीक है. परफोरेटेड कॉर्नियल अल्सर, अगर कॉर्नियल अल्सर में परफोरेशन हो जाए तो पूरा बल्ज कर जाता है बाद में आके. ठीक है बच्चे. Equatorial. The last one is posterior. The last one is posterior. Before that, you have equatorial. If you wish, you can write down. But the other things are not important. At least remember anterior and posterior. And ciliary ka photo. The one which I showed you. The one which I showed. Okay? This is your anterior, intercalary, ciliary, equatorial and posterior. So friends, that was the last topic we did, and we are about to close down the session. So I hope you enjoyed learning with me, and you have understood so many things in patho, so many things in ophthalmology. हाँ बताइए. Hi baby. So friends, I think that you have learned a few things in ophthalmology. कैसा लगा आपको session? Any suggestions which you would like to give apart from my writing, that I should improve on my writing? कोई भी आपके पास कुछ भी whatever suggestions you have, please let me know so that I can improve also as a teacher.